Assalamualaikum everyone, welcome back to my YouTube channel. I hope you all are fine. Now we will talk about web of causation. According to this concept, effects never depend on the single cause but rather developed as a result of the chain of causation. Effects single cause पर depend नहीं करते, depend कर रहे होते हैं result of chain of causation, यानी कि कोई भी effect है तो वो किसी single reason पर depend नहीं करता, उसकी multiple reasons होती हैं, तब जो है होता है। इसी का नाम है वेब ऑफ कॉजेशन। मतलब अगर कुछ भी हो रहा है इंसान को, कोई भी डिजीज़ या कुछ भी सिंड्रोम या वट तो वो किसी एक रीज़न की वजह से नहीं होगा, अगर मल्टीपल रीजंस एक दूसरे के साथ लिंक्ड होंगी जो एक उसके पैथोफिजियोलॉजी बनाएंगे, एंड दैट कैन लीड टू अ सीरियस इशू विच कैन बी एक्यूट, कैन बी chronic, which can be mild, can be moderate, can be severe, can be reversible, can be irreversible, can cause recovery, complete recovery, and rehabilitation, and can cause death. Depend upon type of causes and multiplication of the causes and what the reasons of the disease are. Types of the risk factor: truly causative factors and contributing factors. Means two types of risk factors are available. First one are truly, mean actually responsible for that. As we know that obese patients are more exposed to hypertension, so it is a truly causative factor. When we talk about smoking, it will be a second causative factor. And contributing factors, lack of exercise or inactivity will be additional lack factor, which will be predictive factor and contributing factor. Then a third one is predictive factor. Predictive factor is illiteracy for the infant and maternal mortality. It's mean illiteracy, they are not much known about the actual reasons and what things can promote the disease and how to prevent it. If they are not well known about that, can cause further serious problems. Here is a term epidemic. It is the unusual occurrence of a disease in a population in excess of its expected frequency 4 times. If disease is not prevalent, then presence of a single but confirmed case of that disease at that same time and same place is called epidemic. Types of epidemics are common source of epidemics and single and then second one is common source continuous repeated exposure epidemics. Basically epidemics are unusual occurrence of disease, means it is unexpected occurrence of disease, and it is occurrence was expected but it was expected 4 times less than actual. It was so actual is more than 4 times of expectations, so it is more lethal and more fatal. If disease is not prevalent, then presence if it is not enough prevalent, then presence of even a single but confirmed case of disease at the same time and same place is called epidemic. Even if it not prevalent, a single case is present and same time same disease, then it will also consider it in the form of epidemic. Here are types of epidemics. First of all, we will talk about the common source of epidemics. Single exposure point source epidemics. In this type of the epidemics, the exposure to the disease agent is brief and simultaneous. Basically the exposure of the disease which was in this type of epidemics, the exposure of the disease agent is brief. Basically exposure is of brief time and simultaneous. The resultant case of all develop within one incubation period of the disease, and the resultant case which will develop within one incubation period is disease. When we talk about the example of epidemic is a food poisoning. Then we'll talk about the epidemic curve. The curve below show a common source single exposure epidemics. Here is the curve. It will show a common source epidemic, a minimal incubation period, A plus B usual incubation periods, and number of the cases. The A and B, and this graph shows the picture, and then median incubation period. Epidemic curve is below, show common source single exposure epidemics, and then we will talk about the median incubation period. It is the time required for the 50% of the cases to occur. Normally which time is required for cases and almost 50% cases to occur is known as median incubation period. then in the next video we will cover the next part of the topic. So regarding that, if you didn't get any point, can ask me in comment section. Thank you so much for watching the video.